My first impression of Peoria was that it was a small town and that there wasn't that much to do. But once I got here, everyone was so warm, so friendly.
Driving through Peoria for my interview, I was really amazed and impressed.
It's a smaller city, but I think that sometimes it actually feels bigger than it really is.
Peoria to me is just a great place to live. It's really easy to get around. You don't have to fight traffic after a long day of being on call, and it's really affordable.
There are a lot of things I really love about Peoria.
As a family, we love to go out and go to orchards. We love to come to the Riverfront Museum. We love to go to the Children's Museum here. We love to go biking.
So I love how easy it is to get around. I love the convenience of the community. There's affordable housing.
I can truly say it's the best of both worlds. You have a lot of the big city amenities without the traffic, which is awesome.
The idea of being able to run to the airport, park for free, and be able to fly anywhere I want to fly, I really love that about this community.
Hello, my name is Bhavna Kanikatu, and I'm the Pediatric Residency Program Director here at UECOM Peoria and the Children's Hospital of Illinois. I am thrilled that you're interested in our residency program, and I would like to extend a warm virtual welcome to you. Our program has a long-standing commitment to resident education since 1958. You will find dedicated faculty and a very supportive leadership that will train you in all facets of pediatrics. Our faculty is strongly committed to provide an outstanding pediatric training, and being in a mid-sized program, you will get this education in a very supportive and collegial environment. In 2021, we got approval for an increase in complement size of the residency program. So beginning with the 2022 match, we will be recruiting 12 residents per year.
I chose to come to Peoria because of the excellent training program in the Pediatrics Residency that I was able to receive here. So just like any medical student, I was looking for the best residency program for myself. And I wanted to have an abundant opportunities in leadership and research. I wanted to have a lot of doors open to me for advocacy, for community service. I wanted to be able to feel comfortable after my training, going and getting a job, or going right into a competitive fellowship.
I think what's unique for our program here in Peoria is the people that we attract, both the faculty as well as the residents. You'll be welcomed into a really collegial program where, probably by the end of the first couple of months, you'll have every attending cell phone number in your cell phone.
One of the things that I really loved about Peoria and choosing to come here are all the people that I've met and the relationships that I've made. I think as a resident, you want to work with good coworkers, but more than that, you want to have excellent friends. And I've been able to make that here as a resident. You want excellent attending physicians, and in addition to attending physicians, you want to have mentors. I've been able to have an extensive amount of mentors in my training.
We do a lot of fun things to kind of get to know each other, including, an intern welcome party, to kind of get things started. We pretty early in an intern's year get them set up with a mentor that will be their mentor for, throughout their residency. And we align their interests with that person's interest. And so, I think we really try to forge that relationship.
My fondest memories as a resident are just having people at your home and just sharing your heartfelt experiences and having that time as resident to resident, as a doctor to doctor, to talk about the experiences you've gone through as a physician caring for patients and some of the hard things and some of the really rewarding things that we deal with every day.
people that are looking for a moderate-sized program want to be able to have an individualized education and, want to be familiar. I think it's appealing in comparison to a large program because you don't get lost in the crowd. There's always someone to turn to. There's always opportunities. You get to know people well, be able to do research with them. And so I think those are some of the key things, in choosing a moderate size program compared to a very large, program. We have the same academic rigor. We have the same patient exposures. And so I think it's really, that comfort level of getting to personally know people and not get lost in the crowd.
Our board pass rate, our fellowship match rate, and our successful job placement rate is outstanding, as is our mentorship program for our residents. There are several other resident benefits if you choose to train here in Peoria. You get free food in a cafeteria that's open 24/7. I mean, who doesn't like that as a resident, right? You get free parking in a parking garage that is covered and attached to the hospital. You get a $1,200 allowance to purchase books or software per year, and that rolls over to the following years as well if you choose to group it together and use it to pay for other tests or things like that. If you're presenting at a regional or national conference, you get an additional $1,500 by Graduate Medical Education to pay for those conferences. We also have GME-wide residency opportunities, such as the training session to be residents as teachers, as well as GME-wide UE-Comp rounds, quality and safety initiatives, etc.
You will have a very rigorous education at a large children's hospital. We have a broad range of patient pathology, and one of the unique things is that because we are situated as one of the only children's hospitals in the area, we have a really broad catchment area, and so you will get a large view of different types of pathology and different types of patients during your medical training here.
So day to day at the Children's Hospital of Illinois, I usually get up around 6 o'clock. I get ready and get to work before 7. At 7, you meet your team that you're working with that day, depending on whether you are on the pediatric floors, the pediatric ICU, the neonatal ICU, the emergency department, in an outpatient setting, the newborn nursery. You have that large variety of service areas in one building, which is very convenient. And you meet your team for the day, you prepare to see your patients, and then you work together as a team to round and take care of all those patients. As an intern, you have the opportunity to really learn and have an approachable and safe space to be vulnerable and learn as a trainee and to get guidance and teaching from both your senior residents and as an attending. As a senior resident, you get that autonomy to teach both medical students and interns and guide them in taking care of patients, albeit whatever severity of illness they have. Typically, our day will end around 4 or 5 p.m. Of course, as a resident, you have days that you're staying on 24-hour shifts or longer with that extra care.
In 2020, we implemented what we call the modified X+Y program. So this is sort of like a step off of the X+Y, but we modified it in a manner that our residents have alternating clinic months and non-clinic months. So during your clinic months, you are spending 1 full day of clinic per week in your clinic setting, and you're not running from your rotation to clinic and so on and so forth. Your day is dedicated just to your ambulatory patients. Similarly, during your non-clinic months, you are taking all your time and just spending it with your patients on your rotation. This was a change that was implemented in response to resident feedback, and it has improved wellness and decreased task sharing when residents are trying to run between their clinics and their other rotations, and it has received a lot of positive feedback.
For research, I think that's a highlight of our program as well. Every resident is involved in a research project during their residency program here that is well supported by their residency program and our assistant program director, Dr. Christensen, who oversees the projects. We have a graduated educational curriculum in that, so you don't have to have any experience in research before coming here. The background is laid in a series of educational noon conference sessions, and then it's a really guided experience. So it should not seem daunting at all. Residents have done anything from novel research like coagulation studies in rats to advocacy projects in the community on food insecurity or healthy eating and active play, which I think is a really awesome thing. You can also do quality improvement, which you'll be involved in kind of throughout your education program here.
We have several global health opportunities for our residents, which are as of now placed on hold due to travel restrictions. But we have a very strong connection with FOTCO, or the Friends of the Children of Haiti, where we have multiple mission trips per year that the residents can go on to our affiliate clinic in Haiti to provide care for the children there.
We have a really robust simulation curriculum where you'll be going to a simulation session each month within our JUMP Center to practice, both emergency response and code skills. We also try to incorporate procedural skills into the monthly switch days for the floors, NICU and PICU, to incorporate things that you'll be doing, throughout the month, like bladder catheter placement or central line placement. Or neonatal resuscitation, so that you can always keep your skills very sharp on those procedural skills. We have in situ simulations that occur on the pediatric floors to incorporate our nurses and our PERT teams, so that we always stay at the top of our clinical acumen for response to patient care events. We also are developing, I think, a really fun procedural skills course that or rotation that residents can take during their residency program here.
For me, the most rewarding part as a pediatrician and as a resident in training are having families come up to me in the hallway in the foyer of the hospital and shouting out my name and coming and saying thank you so much for the care that you gave to my child, and them to show pictures of me, them to invite me to follow them or have a piece of their life, sending Christmas cards, those kind of things. That is really rewarding as a doctor, to have that relationship beyond just someone that's treating their child, but someone that has really emotionally connected with them as well.
Peoria, I feel, is a hidden gem. You have all the amenities of a big city, but without the crazy traffic of a big city. It's a very affordable place to live in, and our residents sometimes choose to rent or buy homes while they're here. You can actually have a true life outside of residency if you're trained here in Peoria. Did you know that Morton is the pumpkin capital of the world? More than 85% of the world's canned pumpkin is processed right here in Morton. Before I came to Peoria, I would have been very skeptical of the idea of anything pumpkin related, especially in desserts. But once I tried the pumpkin ice cream here, I was hooked. You'll have to come and check it out for yourself.
My wife and I were looking for something that was more family friendly, and Peoria has offered us that. It's been so nice not to have traffic, to have virtually no commute, to be able to bike to work, to have abundant recreational and family opportunities for both my wife and my 2-year-old daughter. It's been excellent to have all of the amenities of a mid-sized urban center, but also to have a large catchment area of rural area as well, and the ability to get out and go do lots of outdoor activities as well.
Thank you for taking the time to review our website. I would encourage you to visit our other pages, like especially the virtual tours, the resident pages, the day in the life of a resident, the testimonial pages, and all the other residency-related pages to give you a very nice idea of our program in this virtual setting. You can also follow us on social media, on Facebook, Instagram, and Twitter, and all the links are embedded onto this webpage. I look forward to meeting you.
Hi, I'm Aviva. I'm from New York.
From Ottawa, Canada.
From Windsor, Canada.
From Roanoke, Illinois.
From Markham, Ontario, Canada.
From British Columbia, Canada.
From Toronto, Canada.
I am from Shelby Township, Michigan.
Hi, I'm Jamie Livis from Edison, New Jersey.
I'm Amin from Vancouver, BC.
Hi, I'm Katie Justice. I'm a PGY2.
Hi, I'm Amy Christensen, and I'm originally from Los Angeles, California.
Hi, my name is Jessica, and this is my dog Charlie, and I'm from Hermit, Missouri.
I came to Peoria to do residency training, and Peoria was my first choice.
I'm so happy I picked Peoria for residency.
The unique benefit of doing my residency here in Peoria is that we get to experience the combination of living in a mid-sized city and learning in an academic hospital setting where we get to see a broad range of pathology.
It's a great place where you can come and join our department full of awesome physicians and excellent residents. The climate really is conducive to personalized learning and career development with a focus on making sure everyone has the best experience.
This is a wonderful mid-sized residency program where you can see every type of patient and yet have close supervision from your attendings who are always available to you.
I feel like I'm on a personal basis with all the faculty and couldn't have asked for a better group of residents to work with.
I think one of the most unique things about Peoria, being a medium-sized program, is the family feel that we have here.
It's a really great group where you can learn a lot, but everyone really works well together.
The big thing about starting residence here is that I've had a very supportive family so far.
It's a really tight-knit community.
I decided to come to Peoria after I did a sub-I here, and I really enjoyed how invested the attendings were with resident education.
There's lots of benefits to having a 24-hour open cafeteria. It's also nice having a little group of 10 people to call your family as you progress through these 3 years.
We went to Italy twice, once in intern year and once in second year to Florence and to Venice. That was really fun. We went to Milwaukee for a weekend. We went to St. Louis for another weekend. There's tons of opportunity to do fun things here and travel.
It is a collective support by faculty and trainees that has historically led to robust scholarly productivity and national recognition for the work that our residents have done.
Within my first 2 weeks of residency, I had already performed 2 LPs and 3 bone marrow biopsies, all because my attendings knew that I was really interested in Pete's Hem-Onc. So that alone, I think, speaks a lot about our program.
I came here as a resident because I knew I would come out of here becoming not only a great general pediatrician, but also because I would be able to manage some really complex cases without needing to transfer complexity out of our hospital at any moment.
We have specialized faculty that are able to give experience in cardiac cath, electrophysiology, adult conjoined cardiology, echocardiography, and fetal echocardiography.
So we got incredible training and we made lifelong friends, and I think that's what makes the Peoria Pediatric Residency program unique.
At UEComp, the faculty is really focused on both resident well-being as well as education to help you become the best person and physician that you can be.
Peoria is a wonderful place for training. I would call it a diamond in the rough, as we have a tremendous amount of pathology, but within the city themselves, we have a great amount of diversity.
You get a large variety of interesting cases, excellent training, and you get to live in an affordable, accessible city.
I grew up in the Peoria area, and this is a great place to live.
Peoria is a great place to achieve all of your career goals, work in a close-knit community, and chase bunny squirrels, and meet all of your neighbors.
I really encourage you to look into this program because there are so many wonderful benefits, and you'll have a really great experience if you train here.